You know, generally it's not. You can, the way that you can tell if you're in the right place with your needle is you put your needle in and press just a little bit. If you meet a whole lot of resistance, you're in the skin, and if it goes in pretty easily, then you're in the fat. And so you can push a little harder with your syringe, or you can change your needle. But I haven't treated anybody yet where the 6 millimeter in the neck is not deep enough. If you have a really thick fat pad, you can change your needle and do a layer of 10 millimeter, just a little bit, and then go a little more superficial, and you'll get more fat loss if you treat at one level and then go deeper. I'm going to modify this a little bit because you can feel that her fat is thicker here. She doesn't really have a lot here. Is this your grid? You have a dry gauze because this is going to smear.
Dry gauze.
I should probably come around the other side so they can see.
Okay.
What type of needle do you have on your syringe?
27.
27?
Yeah.
How long?
Half inch.
Okay. That's a little deeper than I usually go, so. I'll take this one. I need a gauze to, if it bleeds a little bit, to catch the drips. I like using a grid, but a lot of times if I'm doing a face or a really small area, I'll just kind of mark this way. Do you have a better marking pen? One of the things that I've seen happen when this is done by nurses or people who are not really paying close attention is that they get to talking and they run to the end of the syringe and they forget where they stopped. Now sometimes if you forget, you can see where there's a little bleeding mark, but sometimes it doesn't really bleed. And so I've had a patient come in to see me where a nurse injected, and she injected the same area twice. And she got a fairly significant area of skin loss because too much was injected too close to the skin. So it's real important for you to really pay attention to what you're doing when you're doing this. Don't go take a phone call and come back. Don't get into a conversation because the patient will get into trouble. All right, so I'm going to do some injections, and I pinch the skin. It's real important when you do this that you have almost a crab-like claw pinch, and the more you pinch, the less it hurts. And so the patients really like the pinch because if they a lot of time all they can feel is the pinch, and they don't really feel the needle. Can you ask her if she's doing okay?
Yeah, she's okay.
Okay. Now generally what I'll do when I finish a syringe is I'll erase the marks of the areas that I've treated. So that tells me not to go there again. And that's a really good way that I use to keep track. I try to go as perpendicular as possible. you don't want to go at an angle, because if you go at an angle, you're not at the right depth. So, as much as possible, go straight in. If you have an area that has a really big hump in the middle and tapers out to the edge, a lot of times I'll inject more in the middle, or do a 2-level injection so that I don't have a uneven contour afterwards. Does anybody have any questions yet? It's pretty basic. Do you want to make some comments about your formula? Like how it's KFDA approved and...
This one is...
How long have you had approval? Government approval?
It's
2006?
Yeah, 2006 or 18.
That's pretty long.
Yeah.
Did you know that yours is the only one approved in the world?
Yeah, I know.
That's pretty impressive. Because it's not approved in the U.S. In the U.S. we get it from compounding pharmacies,
Yeah.
and so some are good and some are not.
Usually it's Las Vegas. They are usually, I think.
Mm-hmm. She's doing really well. It's really important not to inject the muscle, and so this is a fairly long needle. It's a 1/2 inch, and if you have small patients, you can inject the muscle. So you can see that I'm not going all the way to the hub of the needle. I just kind of feel it pop through the skin because she's not a big person. What time do you have?
5.
Okay.
4, 5.
All right. We're good.
Yeah.
All right, that last one was a little bit short, so I'm going to put a little more in there. You have a pretty steady camera hand there. Do you have a pad or something she can lie on when she switches sides?
Just to change the side.
Mm-hmm.
Okay.
I was just thinking one of those washcloths or something in case she bleeds. She won't bleed onto the...
What is it? I think it's okay.
You think it's all right? Okay. Just a little more.
조금만 다 됐고 이제 한쪽으로 채우시면 돼요. 물 많이 드시고.
I think for the other side, we'll need that, but we should be all right for this. Okay.
옆으로 오시면 얼음 주. 가는 거 빨리 하게.